The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.
We just ran the gamut on foot problems, leg problems, sciatica, swelling. Chances are you've had it, you've heard it, you've dealt with it.
Lots of people suffer with back pain daily, and to be able to give back to them like how it helped me provides me passion every day doing the job. The longer you wait, the harder it can be to correct. Think of yourself like a professional athlete. Before a game, we warm up. So you could do heat first thing in the morning. Before activity, do heat. At the end of the day or after a game, an athlete would ice. So you can do both to really get long-term results.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Hey, good morning. Welcome back to the Unplugged Healthcast. This podcast exists for various reasons, but mostly just to help you understand that health is more logical than you think it is. It's simpler. It's attainable for everybody. You aren't genetically so disposed to health conditions that you can't live a healthy life of abundance and function. I really haven't spent a lot of time in any podcast explaining maybe my journey or how I actually achieved or got to this point in practice and in life as a career. So I'm going to take a few moments before we get too far into our episode to just back up for a moment. I'm an Iowa guy. I grew up on the farm. My uncle was a chiropractor. I had multiple family members, and it was just a lifestyle for me growing up in a very physical life of working hard on the farm and injuries, sports. And I always got taken care of by my uncle. And it was just something that just I took for granted, that you could actually be healthy without a bunch of drugs, without a bunch of pharmaceuticals. So it was a great way to live and a great way to grow up. Well, I went into chiropractic school, graduated, came out 36 years ago and started a practice. Got pretty successful in helping a lot of people, but I got to a point where I just kind of maxed out mentally and physically. And so I wanted to help other people. And so I went on a journey of opening clinics. That led me down to the road of integrating health clinics, ultimately ending up at what today is AFC Physical Medicine Centers, which integrates medical doctors, chiropractors, physical therapy concepts, nutrition, detoxification, allergy treatment, inflammation reduction, just a good functional way to help people regain their health without high-level drugs, pharmaceuticals, or surgery. Over the years, I've opened over 20 health clinics. We also open mental health care centers to help people in a similar way. If you listen to our last podcast, you'll meet Jason Law, who is the CEO of Mental Health Centers America, and they're treating patients similar to we are, but in a mental health care capacity. Well, this story really leads in to our guest today, and why I would even maybe bring up this story is because 18 years ago, I had the unique privilege of meeting a young, toothy grin chiropractor straight out of college, straight out of Philadelphia, Pennsylvania. He applied for a position in one of our newer clinics. Well, long story short, of course, we hired this guy. He had obvious leadership skills, obvious motivation, leadership, ability to help people, lead people. 18 years ago, he started running one of our clinics. He's, over the 18 years, has grown into an amazing partner, not just a clinic director, not just a chiropractor, a leader, a phenomenal parent, a father, a husband. He runs and owns a couple different clinics with us, and he's continued to help us grow and lead. But more than just being a great chiropractor and a great clinic director and leader, he exemplifies the lifestyle that we talk about. If I could have hoped or pictured the result of somebody that maybe allowed me to lean into him and teach or mentor or guide in any fashion, I would hope and only imagine somebody to turn into or become who Dr. Ryan Sculley is. Would you welcome to the show, Dr. Ryan Sculley? Doc, it's great to finally have you on the show.
Kevin, thanks for having me on.
18 years ago, you came and it wasn't like you were a guy out of shape or in bad shape, but here you are today helping patients understand these principles that I've been talking about, but you live them. Physically, you're in great shape. You look a lot younger than I know you are. Physically, you're strong, stable, healthy. But why don't you just take us back to what got you into chiropractic or this lifestyle, and we'll start there.
Well, I often like to say that chiropractic found me. Started about age 13. I was heavy into basketball, also played soccer. So sports was life growing up. My dad played football. And I really remember after one game, him literally having to carry me off the field because of just severe back pain. And then it kept recurring over and over for about a 6-month period of time. And finally, through a friend's advice, we saw a chiropractor. And I'll never forget, the chiropractor did a consult, ended up taking x-rays, and found out I had scoliosis. So nobody in my family knew if scoliosis, had it. I was never diagnosed in middle school when they do the testing, and started doing adjustments. And between adjustments, teaching me some different exercises to strengthen my back, it changed my life. The rest of that year, there was no back pain. I eventually played soccer, basketball in college without any issues in my lower back, and I knew that that was the profession for me. Lots of people suffer with back pain daily, and to be able to give back to them like how it helped me provides me passion every day doing the job.
Well, you've been hanging out helping us for 18 years. When you originally started, we were just chiropractic alone, and you've helped us and watched us and lived and treated within this integrated model. And through that process, you have also won a multitude of awards as best chiropractor in the East Valley, ranked Arizona best chiropractor multiple years. How do you think that you've done that, and maybe what sets you apart or AFC apart?
Well, I think just like in any profession, it goes back to purpose. The people who are the best at what they do have a purpose and a passion to do it. We kind of live the life of getting adjusted, doing whatever we can to stay healthy, when our mission is to help patients feel better, function better without medications, without surgeries. When you show up like that each day, it becomes easy to do your job. And then I'm blessed with having great teammates. We have 14 staff members in the Gilbert office, which I'm there the majority of my time, and 2 other doctors with a similar purpose that I have. And we have a culture at AFC and in the office of teamwork and then servant leadership, and we show that to our patients. And when you do that together as a unit, you can see some awesome results, and that's the difference. That's what stands out for us. Grateful to win those awards because we get patients results because of that.
Before we get into really the meat of our topic today, when I look at you, you're inspiring to me. I started doing cold plunges recently. You probably were one that inspired me to get there and do that. But if you had to list for the listeners, because if they can see you, which some are listening, if you look on there, what are you, 40? How old now are you?
44.
44. You're bigger, stronger, faster, smarter than you were years ago. What else do you do that people could learn from?
Well, a couple things started over the past year. You mentioned cold plunging. For about 2 years, I've been doing that. I find it's amazing with help reducing inflammation in the joints. I do it first thing in the morning, so it's best to do it right away, get it over with. One thing you taught me back 18 years ago, a saying is you always want to eat the big frog first. And so you want to do the hardest thing that you can do throughout the day as quick as possible, get it over with. So every morning, I've done it for 2 years, but every morning I don't want to go in there. It's about 44 to 48 degrees. I have it at my house, and you just jump right in. You sit in there for about 3 minutes, and you just feel invigorated afterwards, have energy. I try to run 3 times a week, drink at least half my body weight in ounces of water. And lastly, about a year ago, started going on more of a high protein carnivore diet. And I think that's really made a difference with just thinking, reduce inflammation, energy, really cut sugar out of my diet.
I've known for the lifespan of being around you that you are always on the cutting edge of finding better ways to be healthy. But one thing that's pretty consistent is that you eat consistently. You don't maybe do intermittent fasting, which is a conversation we've had on this podcast multiple times. You kind of do almost the opposite. Explain maybe your thought process of when you eat, how much you eat, routinely your eating habits.
So after cold plunging, I like to exercise. So I'll get my workout in usually between 5 and 6 in the morning, and then drink, try to get at least 30 grams of protein to 50 in a shake after that. And then throughout the day, I try to break up every 2-3 hours small meals and get in I'm around 200 pounds of protein, grams of protein, and then some fats, avocados, fruit, vegetables, and I'm almost completely off of other starchy carbs and sugar. So if you can maintain eating smaller portions every couple of hours that's higher in protein, keeps your blood sugar regulated, gives you energy throughout the day, and your body will burn it off as long as you're staying active.
So you're almost just got a metabolism that you just feed, and you eat a lot of calories probably. It never adds up to you as far as like gaining weight or so to speak. You're just able to maintain a level of metabolism and weight. It seems like those two go hand in hand.
Correct. Oh, yeah.
All right. Well, our topic today, as we see a lot of these conditions in our clinics all the time, and if you've done anything physical in life, chances are you have either had a foot injury, a knee injury, a leg injury. These are big problems, and it really slows people down. If you watch the NBA Finals this last weekend, the star for the Indiana Pacers literally tore his Achilles in the last game, and it ended the game basically. That it was the reason that probably they lost or had no chance to win. Foot injuries take you out, knee injuries knock you down. So today we're going to give you and unplug you from foot problems, knee problems, leg injuries. So here we go. You ready, Dr. Sculley?
I'm ready. Fire away.
I got a boatload of fast, furious questions. We're going to hit you, and let's see how much information we can give to these people. Dr. Sculley, the number one common cause of foot pain.
So in our offices, believe it or not, the most common reason we see foot pain actually stems from the lower back. So nerves in your lower back go down your legs all the way down to your feet. And many times the body compensating because of pain or nerve impingement puts pain. You notice it more on the bottom of your feet. It can result in even bunions because you start to change your gait. Plantar fasciitis is something common. So I would say between nerve pain, plantar fasciitis, bunions, that's the most common things we see, but it usually all starts from misalignments.
A lot of people say they don't have lower back pain, but they have feet pain. Could their foot pain still be coming from their back if they don't have lower back pain?
100%. We see that all the time. Many times you'll feel symptoms the furthest away from the nerve where it originates. So the nerves in the lower back end up on the bottom of the feet. And there are many times that we will see just foot, knee, thigh pain, but nothing in the lower back. In our office, we're very thorough, so we always do an exam. We may take x-rays, and you can almost 100% of the time see degenerative disc, arthritis in the lower back that's creating the foot pain. You get the pressure off the nerve, the foot feels better.
A lot of people deal with heel pain, especially early in the morning. Why does heel pain seem to happen more commonly early in the morning?
I start to notice this more in your 40s. When you're sleeping, you're not moving. So when you're not moving, there's not blood flow. You're not getting blood flow to the joints. And when there is any sort of arthritic change in the foot, tight tendons, they will tighten up throughout the night. So when you first step or start walking in the morning, you're going to feel it the most. As the day goes on, you get more blood flow, you start moving more, it tends to help the pain.
So if someone has early foot pain like that, what's the best thing they can do to kind of get through their day?
So a few things at home that you could do. Ice, you could put foot in ice, top, bottom of your foot. You can freeze a bottle of water and roll it underneath your foot. You can even, while you're sitting at a computer, take like a golf ball, rub it underneath your foot to start to break up some of the tightness in the tendons. And stretching your calves. You could put your foot up against the wall so your foot's elevated, get your heel as close to the wall as you can, then lean your upper torso towards the wall to really stretch your calf. Usually do that about 3 times a day, 30 seconds. And if you can release the tension under the foot, get some ice to reduce inflammation, stretch the calves, it'll do wonders for the foot pain.
A lot of people love wearing high heels. A lot of women love wearing high heels. Are high heels bad for your feet?
They are definitely bad for your feet. They may look good, but it doesn't help the foot pain. The minute that you start raising the arch in your foot to that extreme, it puts more pressure on the bottom of the foot, which will lead to inflammation over time. Many of them have a tight toe box, so it's creating more pressure and stress on the joints. And over time, it's going to lead to pain, can lead to bunions. So optimal, you want to wear shoes with more support and not wear the high heels.
Is there a fashionable shoe that women could wear that would be an alternate to heels?
There are sandals made with the arch actually put in there. We order those in our office all the time. It helps so your feet are out, not closed in, but you have the arch to help support the foot, and it's not elevated like a high heel.
Dr. Sculley, obviously as a chiropractor, people are going to think that you're biased, but can chiropractic help foot pain?
Of course. You knew that answer was going to be yes.
Of course.
We see it all the time. So other than originally starting with the lower back, we do an exam, we take x-rays, as I said, and we look at the alignment. And based off any misalignments, we're looking for symmetry in the lower back. So the hips are even, and we'll do adjustments to help align that. You can start to notice results very quickly that just doing that can help the foot. But then there are many joints in the foot that you can adjust. In our office, we adjust knees, we adjust ankles, we adjust the feet. And when all the joints are moving properly, it does wonders to take the pressure off the feet. There's even massage techniques you could do that can help make the foot feel better in a quick amount of time.
Okay, heels are bad, we know, but what footwear do you recommend for people to wear who have foot pain or knee pain or hip pain?
Any shoe that's got arch support, and more often than not, since actually back when I originally started going to chiropractic at 13, one thing that was recommended to me that I started doing was what's called orthotics. So they're arch support, additional arch support that we put in the shoe. We take the original sole out of the shoe and you can slide these arch supports in. I've been wearing it for the last 30 years. I've got 3 boys, they all wear it, and it can do wonders to support your foot, support your knees, your hips, and maintain the alignment. You want a shoe that's going to provide good arch support, but even with that, I would be wearing orthotics. I think everybody could benefit from it.
All right, if you had to sum up as we kind of move to a new set of questions here, what would be the one tip you'd give everybody when you talk about reducing foot pain?
If you could stretch your calves 3 times a day for 30 seconds, by putting your heel as close to a wall as you can and lean forward to that, it's going to help reduce the pain. You brought up Tyrese Halliburton having an Achilles injury just the other day. Well, it started with a calf strain. Playing on it will eventually, almost all the time, lead to an Achilles tear. So consistently stretch your calves each day.
Well, that leads into our next set of questions, which I play a ton of pickleball. Number 1 injury and number 2 injury actually is a torn Achilles tendon for people, not really stretching out. People who maybe don't have foot pain but want to prevent getting these things. Let's go there. How can people prevent foot pain?
I believe wearing orthotics. Number one thing that you can do is provides more arch support in your feet. I talked about calf stretching.
So stretching, of course, is beneficial. And you talked about the Achilles stretch. Are there any other stretches that people could do to just help either lower extremity or feet problems?
Stretching your hamstring would be next. It can be as easy as putting your foot up on a chair and then leaning down when your leg is straight. That'll help stretch the muscles underneath on the backside of your leg, and then leaning next to something like a chair to support and grabbing your foot, keeping it behind your body to stretch the front of your leg, the quad. As simple as that for 30 seconds holding the stretch can make a big difference in leg tightness and pain.
A lot of times people go to a chiropractor and all they ever get is an adjustment. Do you involve stretching along with your therapeutic treatments?
We do. It's the basis of what helped me get better. That's what we provide our patients. We do a series of maybe stretches, some exercises, help get mobility into the body, and then the massage. And then the last thing we do is the adjustment. Our belief is if you're not loosening and strengthening muscles to support the adjustment, it's not going to hold the way that we would like it. So we get quicker results and they last longer by doing that. It's always good to warm up the body first.
A lot of people have heard and even said, gosh, you go to a chiropractor, you always have to keep going back. Is this a treatment or is this a way to kind of prevent some of that?
100%. Our basis is we always have a start date and end date. So in our office, we use x-rays to figure out an exact treatment protocol. But when somebody incorporates the muscle work with the adjustment, you can actually, at the end of a treatment recommendation, retake x-rays and see a change. And a patient doesn't have to come back as frequently, and we make sure they have a routine at home to help support the treatment that we provide.
Ice or heat for foot pain?
So you actually both would be the answer. And what I mean by that is originally when you first start to feel it, the first 3 days I would be doing ice. So ice about 15 minutes, 2 to 3 times a day. Once you get past those first 3 days, you could do a mix of ice and heat. Think of yourself like a professional athlete. Before a game, we warm up. So you could do heat first thing in the morning before activity, do heat. At the end of the day or after a game, an athlete would ice. So at the end of the day towards nighttime, do 15 minutes of ice. So you can do both to really get a long-term results.
How often should someone see a chiropractor for foot problems?
So it varies based on the condition. The longer you wait, the harder it can be to correct. But I would say generally a good train of thought is in the beginning. It could be weekly, just like going to the gym. If you want to make any change, you got to retrain muscle memory. It takes time. So weekly in the beginning, and optimally someone would get down to bi-weekly or monthly just to help keep things aligned.
When it gets to foot pain, there's a lot of confusion. Is it just from getting old? Because everyone thinks they get older, they must get worse.
No, it can be more common when you get old because you might be dealing with something longer, but it starts with alignment. So we have seen problems. We see many teenagers, 10, 11, 12-year-olds that start to have foot pain at an early age. Nowadays, I've got 3 boys in sports. They're practicing almost every day. Many times there's no off season. You want to get really good at one sport, so they may be doing it 5 to 7 times a week training. So it is more prevalent now than ever in younger kids. And the earlier you can take care of it, the quicker it goes away. So actually, I'd say the opposite. We're seeing it more now in younger kids than people above the age of 40.
In my 35 years of treating patients, I've heard this problem or this question so much as I'm just getting old. And I would ask you this question. If you're having a right hip, a right knee, a left hip, a left back, an up right shoulder, is your left shoulder the same age as your right shoulder? Is your right hip the same age as your left hip? Is your right knee? See, it's not an age thing. It's a time over trauma thing. So left uncorrected and time, yeah, you're going to find something feeling older, but it's usually not due to age in itself. All right, Dr. Sculley, do all foot problems require surgery?
Great question. Definitely not. We see a lot of foot issues in our offices, and it can typically be fixed with conservative treatment between aligning the spine, as we talked about earlier, massage therapy, stretches, we went over that, exercises can really make a difference and get results quick and not get to the point where you need surgery.
We know orthotics are good, heels are bad, but what about flip-flops?
So typically flip-flops would be bad because they're very flat, can promote a lot of stress on your foot. There are some now that are made with arch support specifically, so those would be ones that I would recommend wearing. But if it's a typical flat flip-flop, no, it is definitely bad for your foot.
Well, we hear a lot about grounding, and I know grounding is a good thing, but what about going barefoot?
I think it's a positive. I mean, obviously, if you're walking on a hot surface, it's not going to feel good. But if you're walking on the ground, for example, it can help to strengthen the muscles underneath your feet, which can help support the arch, get the arch back. And yes, grounding definitely can help reduce inflammation. Typically, I mean, optimally, you're going to walk barefoot on grass up to 8 minutes a day to really help support your feet and to help with grounding.
Number one, again, what would be the number one best thing, what a daily habit that someone could do to protect their feet?
I would go back to me wearing orthotics, wearing proper arch support, and then stretching. Again, we went through a few stretches, so calf stretch, hamstring, quad stretch. When you do it consistently, it's going to stop more of the acute injuries that we see all the time in our office. Many times people wait till they really start to feel the pain rather than just doing a little bit of stretching each day in the morning is going to stop some of those things from ever happening.
We're moving up. We're moving up the leg here. We're going past the foot here into the leg area. You had a son here recently that had a leg injury. I'm sure you were trying to prevent that. Well, what do you think the number one cause of leg pain is that you treat?
So his was from a trauma in football, but typically we would see it coming from nerves. Again, the nerves in the lower back go all the way down the legs, and many times it's a result of a nerve that's being pinched, typically L4, L5 in the lower back, that radiate pain to the leg, and that's what patients are feeling when they come in.
A lot of people get confused with the word sciatica, leg pain. When should someone do something when they're feeling leg pain?
As quick as possible. Most health conditions will typically get worse as time goes on. There can be a difference between muscular and nerve pain. Nerve is going to be usually more radiating sharp pain, can even show up as numbness, tingling. Muscle is going to be more like tight achiness. When you start to feel that tightness, achiness, you want to definitely be stretching. You want to intake more water. You want to start taking magnesium is a great option. But as soon as if you get to the point where you're feeling numbness, tingling, sharp pain, shooting pain, you want to see a chiropractor. it can really give you relief in a quick amount of time.
A lot of people are confused. In that conversation, you just said the feeling of muscular and nerve often feel the same. What would be maybe the top two ways that they could determine if this is a muscular problem or a nerve problem?
Definitely start stretching. So if you go through some stretches like we talked about, and if many times the pain feels even worse, it's a sign that it's a nerve pain. If it becomes sharp, typically with a nerve pain, you may get some sharper pain if you're just bending, leaning forward, or twisting. In our office, we take people through range of motion. X-rays is a great way to see if there's any wear and tear in the lower back that could be causing it. So there's some things you could do at home as far as stretching, but if that's not going away, it's a sign that it's more of a nerve pain and you want to get looked at by a healthcare professional.
In my experience, if I could add to that, there are two ways I always found the difference between a nerve pain and a muscle pain. Number one is if you feel the pain cross a joint, which means if it goes from your thigh past your knee, or from your hip into your leg, or from your lower leg into your foot, if it passes a joint, it's a nerve problem. Another one is if you sit still and you're not actively moving the muscle and there's discomfort, achiness, chances are it's a nerve. Muscles usually hurt when you use them, and they don't really hurt so much if you're not using them. There's my 2 bits of tips. Let's keep moving. A lot of people I've seen, especially as they get older, wear compression socks. Do these things really help leg problems?
It can help. Currently, my dad's wearing them. It helps. It helps typically with swelling. It's going to help move blood flow. When there's more of a vascular issue, compression socks can make a big difference.
So when people are having pain, they often get really sedentary, but often we say they need to get active. Is walking good or bad for leg pain?
Very light, slow walk you could start with. If you can get even to the end of the driveway and back, quarter mile and back, that's going to make a difference to start, create blood flow. The more that you're sitting and not moving, typically the worse the condition will get.
Number one again, what's a number one lifestyle habit that people can do to help from or during having leg pain?
I would say stretching, again, with hamstrings, quads. As we talked about, a light walk. I think in the very beginning, a hot shower, putting heat on the air first thing in the morning, and then utilizing maybe ice if it's coming to the leg in the evening.
A lot of people deal with leg cramps, restless leg syndrome. What causes leg cramps?
So typically we've seen that come from the lower back the majority of the time. When the nerve is impinged at L4, L5, again, it radiates into the leg and can create cramping, muscle tension, tightness. There can be times that you're dehydrated. So other than alignments to the spine, you want to make sure that you're intaking half your body weight in ounces of water. Also a magnesium pill, especially at night, or eating a banana for potassium at night, can help balance the body so you'll avoid cramping at night.
A lot of people are very active, which is a great thing, but sometimes when they're out there, they don't stretch out enough. They pull muscles. How do you recover from a pulled muscle?
You want to get to ice. So ice right away, first thing, 15 minutes at a time, at least 3 times a day. Many times you can lay down, elevate your leg, and then you want to very slightly start to walk and move. You don't want to push it, start running right away, but walking to help get blood flow in there, and then some very mild stretching. But first thing you want to do with that is you want to ice.
All right. I always say you are what you eat. What foods help ease leg problems, leg pain, leg inflammation?
So you want to eat food that are high in omega-3 fatty acids, anti-inflammatory. So an example would be fish. Salmon's a great one. Fruits and vegetables, so berries, leafy green vegetables, and then avocado's a great idea as well.
We have a lot of jobs that require us sitting all the time. Is sitting or standing worse for leg problems?
Both can affect the leg, typically more standing for long periods of time. So I prefer like more of a seated standing desk. So if you can get to where maybe you're sitting for about 30 minutes, the reason why that can be bad is it can compress the disc in the lower back, which could affect the leg pain. So maybe sitting 30 minutes, then standing for 30 minutes and going back and forth. A variety is the best thing you could do throughout your workday.
Sometimes people get swelling in their legs. What causes swelling in someone's leg?
blood flow deficiency, body not getting blood back up towards the heart the way that it should. So you can use compression socks for that. You can lay on your back with your legs elevated, will assist the body in getting blood flow to stop from pooling down by the calves.
A lot of people let leg pain go and just kind of deal with it. But what are the red flags when it comes to leg pain?
When you start to get to a point where you notice any numbness or tingling right away, that's a red flag. That can indicate a severe nerve issue. You want to get that looked at right away. Any sort of radiating sharp pain is another, because the big thing is we do not want that. When we start seeing nerve-related pain, that's a red flag. So pain that crosses over a joint, pain, that numbness or tingling that you feel, because we've seen many times you can even get to that too late, where the times that it does require surgery is when patients might present with that and the disc is so bad that you can't revive it. That's the only thing that you can do. So when you start to see any of those symptoms, sharp pain, numbness, tingling, you got to get in and see preferably a chiropractor right away.
So someone comes in to see you or see one of our clinics, how long would they expect before they'd see improvement with their feet, their legs?
Many patients will feel it within the first couple of days. First visit, we want to be very thorough, make sure that we have an exact diagnosis of what's going on. But as soon as we start treatment, patients will notice improvement within the first visit to first couple of visits.
All right, guys. Well, we just ran the gamut on foot problems, leg problems, sciatica, swelling, radicular pain, muscle problems, the whole issue. Chances are you've had it, you've heard it, you've dealt with it. And what you should have noticed, though, through all Dr. Sculley's answers is that there are consistent, similar answers to different leg symptoms. So don't get thought that there's 1,000 different problems. Often there's about 3 or 4 things that really go wrong with your leg. What you should have also noticed is none of his answers actually required medications. So Dr. Sculley, my last question to you, is there an actual place and time where drugs is really an answer for leg problems?
Well, I think that it's rare in our world, but the biggest problem is when people wait too long. There have been times where we've gotten to where we see patients with leg pain. There's been numbness, tingling, and it's been going on for so long. They've tried medications, they've tried everything else first, and we take x-rays and the disc is so bad, there are times where it gets surgery is the only option. So the biggest thing the listeners can do out there is when you start feeling it, don't wait. Health conditions get worse as time goes on, and it can take years to get to that point, but we've seen patients who have waited years upon years to where it's too late.
Well, that definitely leans into something I have seen too often, and I want to just talk to you as our listeners that often in the world of maybe holistic chiropractic and just more natural thoughts, we end up being the last resort. And I have to encourage you that you got to consider things more logical, functional, simple before you move into those things of medicine or pharmaceuticals or surgery. One thing, though, I'm afraid the listeners may have heard or may think is that if they go to the chiropractor, you don't know if you can't fix it. You won't refer if you can't fix it. Let the listeners know the thought process of why we would be first. And if we can't fix it, what do you do?
So why would we be first is there's many side effects with medications. And so when you start going down that road, it can lead to other side effects. So even if you're taking a medication, leg pain starts to feel better, it can have other adverse effects in your digestive tract, to say the least. Or certainly if you go to a surgery, it may work 50-40% of the time and there's no going back. So it's the easiest thing, most simple thing to do is start off with chiropractic, start off with, in our offices, we combine physical therapy, massage therapy. So we're going to look at where it originates and the muscles, and it's the simplest potential fix. If we can't, if you're one of the cases, a small percentage where we can't fix it, within the first few weeks, we're going to know. And if we're not getting any results, we have many great relationships with medical doctors, orthopedics, that we would refer you to at any of our locations if they're going to get better results with you. We don't have you coming in for a long period of time just to tell you it's not working. You're going to notice a difference in a pretty short period of time. If not, we're going to refer you to the right people who can help you.
Well, that's great to hear. And I hope that lets our listeners understand that you can trust doctors who think like this. Not all of them do, but we do at AFC for sure. Last question before we close this thing up. People are confused. If they need an MRI, you would know it.
Yes.
I know. But they don't think you can order it. Is that true or not true?
So we can 100% order MRIs. We do that all the time in our office. And in the situation we were just talking about, the person maybe isn't getting results over a couple of weeks, we can write an MRI. We can get the results back just as fast as a medical doctor can. And then based off the MRIs, we can read them, go over them with you, and figure out what's the best provider to help you.
So you don't have to go to your primary care doctor to get an MRI written or an orthopedic surgery. Your chiropractor actually has the ability to order those, get it read, and help you understand what to do with the results. So there you go. All right. Well, I hope we brought you some value today. A lot of problems involving lower extremity issues. And today we brought you some answers that are more logical, more functional, and more simple than hopefully you would consider looking into. So we're going to sign out here today. Again, if you do me a favor and share these podcasts with others, this is our marketing plan. If you don't share it, no one hears, and people just take drugs. They get worse, they get bad, they get old, and that's not necessary. You can live this life like a candle, burn bright to the end. You may get a little shorter, but it does mean you have to get dimmer. All right. Well, this is Dr. Wall and
Dr. Ryan Sculley.
And we are signing out. If they actually want to find you, Doc, you're at the AFC Gilbert location, AFC Physical Medicine of Gilbert. Look him up. Look us up, AFC Physical Medicine. But we'll see you again on the next episode of the Unplugged Healthcast.